But nurses often get told about abrupt changes in behavior and they're consulted to by the teachers or bringing it up with the teacher. So they're really key to being a good relationship with them. And again, you're going to also ask with a nice call to the teacher if they would please tell you if anybody in the classroom has strep, emphasizing, because they go, we can tell you who it is. I don't need to know who it is. I just need to know if it's there, because if they're in proximity to that child who's shedding, remember, we shed infection 2 or 3 days before we get the illness. So COVID is 3 days, strep is 2 or 3 days. Kissing sickness is just, sharing drinks for some kids in high school, especially. The kid can have strep and your kid's getting it before the child shows up with strep. Same thing in your families. And if the teacher's been diagnosed, this is a big issue in a community that you all know who you are, where a classroom in one school just had so many kids with pandas. It was just ridiculous. And it turned out the teacher slipped one day and said something about her son with strep, and we always thought maybe she also had it.
Peggy, I just want to say maybe 5 more minutes or so. Is that all right?
So this is a sample letter. You might want to redo it. That goes to the school, that the school will actually put out in your grade or class to let the parents know that it's important for them to tell you that they have strep. There are some kids who have such bad strep, it really totally inhibits their function. So some of these are very appropriate. Not everybody needs one of these, but you have to think about it. These are resources for PANS, PANDAS. The PPANS is the physician network. There's a wonderful article to give to your primary care person, seeing your first child with PANS. Pretty much like the New American Academy, although a little bit better written. That's a really good resource. Aspire, as I mentioned, is a wonderful resource for webinars, school instruction. Tons of research is recorded there. And our Dear Look Foundation here in Massachusetts, which has got a lot of parent support, grants for treatment, and a lot of resources. And then again on the web, there's tons of other places that are giving you information. These are books. Some of them are older because I'm not always kept up on everything, but these are the 2 main ones on schools. This one by Candelaire Green is almost like a textbook, so you kind of use a section of it. You don't think you're going to sit and read it all. Pat Duran's book is much more readable in terms of giving it to educators, like giving it to the school and saying, please look at this, or the SPED directors. Saving Sammy is famous by Beth Maloney, her original book. And then the really good book still, even though it's 2013, is a pretty good explanation about what PANS looks like. I don't always agree with some of the stuff in the book, but that part about what is it and how it presents is still very accurate. And then I just mentioned these 2. I'm sorry. These are some great kids books, and A Pickle Over Pandas, A Child's Introduction to Pandas, and My Story About Pandas. One of the best ones I'd say is a mix between pictures and words. A couple of these are more pictures, a couple of these more wordy. And then When Your Child Has Lyme Disease, it's a parent survival guide there. There's a lot of other books on Lyme brain. And then another picture book for pandas. This is for family educators. So this has a lot more words in it. Brain Under Attack is another one around pandas and autoimmune encephalitis. This illness is referred to as autoimmune encephalitis by some of the medical staff. However, I need to inform you that your primary care physician and even neurologist that you might run into think that autoimmune encephalitis looks like a person in their ICU who's seizing and almost dying, because there's a very specific illness that happens with autoimmune encephalitis, like a tumor on your ovary for a girl, or a brain inflammation from bacterial meningitis, or a very known one now that was only discovered and named maybe 20 years ago, where an antibody attacks a certain part of your brain and causes autoimmune encephalitis. This was made famous by a book you might all know called Brain on Fire. That's a very specific AE event, but that's what they think autoimmune encephalitis is. So they're like, they don't know what they're talking about. Are you crazy? Your child's going to school. Their child's sitting in front of me. They don't have autoimmune encephalitis. Don't even bring it up, is my experience. And there's some more here around students and educators around Lyme, as well as is it PAN? This is an older nurse out of 2015. Is it PANS, CANS, which is another way of describing pandas. Closing thoughts. Kids do get better. For the people who come to my office who've been sick a long time, it's a long recovery, just to be really frank about that. Kids who come in early, like first time they just had strep 2 or 3 months ago, they're just starting to act out, and they don't have a long history, often recover quicker and better. But if they have an underlying tick disorder, which I don't identify for some reason, they could get better, and then they're back in my office with mycoplasma pneumonia. Then they get better, and then they're back in my office with some other illness. The immune system just is too disrupted. Earlier diagnosis, better treatment outcomes. It's a spectrum in terms of how it presents. Certainly people in my office are much sicker than some others. Not all patients will have all the symptoms. You only really need one of the beginning ones and one of the middle ones, two of those major lists. The symptoms are relaxing and remitting. It's a chronic illness for many people. That's the flares coming and going. And you really have to be a partner as a clinician with the family. It takes a whole team. Please don't blame the child or their parents for their illness. And this is medical. I keep saying the symptoms are psychiatric, but it's a medical illness. The metaphor I give families is if you had a gaping wound on your leg, I come along with bandages to keep you from hemorrhaging to death while you're trying to treat that wound. But the psychiatric medications will not change this illness. It's really important to understand. But they are not to be avoided because you're often leaving your child in misery when you could actually relieve some of their symptoms and help them, help them have some semblance of reasonable ability to engage with things that they might want to do. And I'm done, Sheila, if you want to open for questions or share questions.
Yeah.
Do you want me to share my slide back or get out?
You can stop sharing. Is that what you?
Yeah. Let me see.
Yeah, if anyone has any questions, you can put them in the chat for sure. It looks like there's one. I can read it. Is there a connection between autoimmune encephalitis and developing visual snow syndrome? Huh.
I have seen visual snow syndrome in major inflammation. I think the two cases I can be sure about are COVID, post-COVID. And what visual snow is looking, if you're looking at an old black and white movie and it's snowing in front of your eyes. Sometimes it's on one side and not the whole. It's a neurologic symptom. But unfortunately, this person was told by an ophthalmologist that, no, it's no big deal. Well, it is a big deal. It means there's something wrong in your neuronal occipital. Remember I said it's in the back where our visual is? There's something in the dopamine tract that's bothering that area. Other things kids have described are blue hazes. These are the visual hallucination kind of stuff. It's not a hallucination of snow, by the way. And then you have to differentiate. Sometimes you see colors and shapes, funny shapes when you have a visual migraine. So if there's a headache attached, you have to kind of sort that out. So it's still helpful to have a neurologist checking things out if you have this visual snow, or a neurologist, I'd say.
Okay, here's another one. Tips when perianal strep won't clear. Azithromycin helped at first, then didn't. We haven't had a clear swab in many months.
One would usually use other antibiotics that I mentioned earlier, cephalexin, Augmentin. I did find out Augmentin, which is one of the god-awfulest liquids around, is now able to be flavored with bubblegum or cherry or something like that. So that would be another option. But my guess is if you've tried it, you may not have been on it long enough. Just remember that this often requires long-term treatment, not what a pediatrician is likely to do. And to be fair to pediatricians, just to remind you, they are monitored how many antibiotics they give them for how long, and they are not allowed generally in their practices to give more than 10 days at a time or 2 weeks. Sometimes you can beg them for 2 weeks, especially if they see the results, but you cannot expect them with rare occasions to continue long-term antibiotics. That is a real hazard to all of you.
Okay, here's the next one. Can you speak more to visual motor tics, visual field loss, one pupil larger than the other, which is anisaccharia?
I haven't heard that, but the pupil dilatation is usually bilateral. If it's one, I would suggest to me that only part of the brain is creating that. Often it comes along with hyperadrenalization, which happens around 3 to 4 in the afternoon. Your child all the symptoms start getting higher and louder. And those are often when the pupils dilate, which is called mydriasis. What was the first 2/3 of that question? I got the back end of it too.
Visual motor tics, visual field loss, and one pupil larger than the other.
If there's visual field loss, then I would think you'd need a more thorough evaluation neurologically, perhaps a CAT scan, MRI, because that's more neurologic for sure. And it could be caused by PANS, but you don't always know it is.
Could it
And
also be like Lyme?
um,
Lyme has some visual stuff, doesn't it?
possibly, yeah. But again, it's neurologic if it's going on. So you'd really want to be clear neurologically. And then you might go back and see if Lyme's there. In other words, if all the scans are negative, all your exams are negative. But something like one-sided is often like migraine. Migraines are almost always one side, not if you have headaches all the time this way, it's often sinus or it's stress, but migraines are almost always one side.
Okay, sibling support group suggestions. I'm trying to think. Sibling support group, maybe
Well, it's been suggested, and the problem that happens is getting them to go. It was tried a number of years ago by New England PANDAS people. It's still a huge need if anybody has a desire to start one. I think what they found in the sibling group, or even the patient group, they try to do patient groups, get teens together and talk about it. Many kids in the middle of this illness don't have words to describe it. It's often kids who are healthier that can talk about it. But it's a huge need for siblings, but it's not done. So there's where the therapist can be supportive also if they understand the illness to give support. But it's a really big need. I don't have a full solution.
okay. Is there a specific brain scan that can be done to show what's going on?
I want to say one of the things, I've also had requests for grandparents groups from grandparents who are feeling that they really live with this, they've waited by it, they're participating in it, and they don't feel like they have any area of support, by the way, and that's true. Now the question, yes and no. One of the huge issues is I had an MRI and it shows no basal ganglia inflammation, no enlargement. That's because the studies that have been done in PANS for basal ganglia, OCD, and Tourette are very specialized, very targeted basal ganglia measurements, which are not done in normal MRIs. In fact, unfortunately, when you look at the workups, and even though in the PANS consortium and that whole diagram you can see when you look has MRIs, CAT scans, cerebral spinal fluid taps, rule out. Very few clinicians ever do them in PANS treatment unless they see things that tell them they need to. So like a visual change would be one of those things you might want to be doing. Is there something on the motor cortex that shouldn't be there? fMRI, which is F is functional MRI, which is where you're getting an injection usually, shows volumetric changes like is the hippocampus smaller than it should be? Is the basal ganglia smaller, bigger? Is the frontal cortex change? Very few people do those, and there's not any real research in hands about that. The PET scan, which is a different kind of brain scan, it does much more detail. Often I believe it's infused. Some doctors, like Dr. Younger in New York, and I heard of a neurologist who, well, he didn't do a PET scan, have identified, have done them. Dr. Younger in New York has done them. He also does muscle biopsy, tissue biopsy to see if you have what's called small fiber neuropathies. In other words, all your neuronal tracts are coated with myelin sheath. It's white matter in your brain. It's a fatty acid cover. It's what degrades in multiple sclerosis. Anyway, he's seen those areas damaged in PET. So, but it's not really good. There was an MRI study by Dr. Williams, and I can't remember if did he publish that, Sheila, at one point? But you might look up to see if there's an article by Dr. Williams with MRIs for kids with pain. But basically, CAT scans, MRIs, they really only show more gross abnormalities, and only in the higher level where injections are gone in, where they inject glucose that's radioactively monitored so they can see where it goes. That's what activates, and/or structural like PET scans and fMRIs, and those are not typically done. And you're not going to have an indication to do it unless you have a really seriously abnormal neurologic presentation.